Good afternoon, and thank you all for joining us today. On today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, and Darren Roush, Health Officer and Director with the Greenfield Health Department. Mayor Barrett, I'll hand it over to you to get us started today.
Well, thank you very much, Catherine, and good afternoon, everyone. We've got some really good news to share, and it's an exciting update on our COVID-19 gating metrics for the week. We have moved from the substantial to the moderate transmission category for our rate of COVID-19 cases per 100,000. What that means is it's a decrease from 51.2 last week to 26.8 this week. This is the lowest observed case burden since March of 2020, and it's a major accomplishment for our city. So I want to thank everyone who's been a partner in this, that we've reached this very, very important milestone. Even more good news is that for our percent positivity rate, we remain in the low transmission category, and we're down from 3.4% last week to 2.2% this week. Again, a major, major accomplishment. And as we continue to see an increase in our vaccination rate for Milwaukee residents 16 years of age and older, we are clearly making progress because now we're at 42.9%. That number can go higher. I want that number to go higher. And I want us to focus on a lot of the census tracts where we're seeing a lower number. And that's something that the health department is actively working on. But it is clearly exciting to continue to see our numbers improve. But I also want to caution everyone that we have to continue to move forward and that our path for recovery is not guaranteed. It means we're going to have to continue working because with the loosening of restrictions, we are seeing that people are starting to return to the people and places that they love. That is great news, but we cannot completely throw caution to the wind as we return to public spaces. So let's get back to normalcy safely, and let's continue to practice common sense measures like washing our hands, getting tested when not feeling well, get that vaccination, and wear a mask indoors if you're not vaccinated. So I'm going to continue to beat the drum on vaccinations. Vaccinations and vaccines continue to be, without a doubt, the most effective tool in keeping our community safe and protecting against COVID-19. With the closing of our Wisconsin Center last Friday, which was not a bad thing, it's just we're moving on to a new chapter. I want to remind everyone that the city continues to offer quick, easy, and free vaccinations for Milwaukee residents at the Northwest and Southside Health Centers on Monday, Wednesday, and Friday from 10 a.m. to 4 p.m. and Tuesday and Thursday from 10 a.m. to 6 p.m. Beginning Monday, we will no longer be offering vaccines at the Mitchell Street or Zablocki libraries because we've reached the conclusion that anybody who wants a vaccine and goes to those libraries has gotten a vaccination. The Washington Park Library, located at 2121 North Sherman Boulevard, will remain open with reduced hours on Wednesday and Friday from noon to 4 p.m. Now, the Washington Park Library is an important location because one of the articles or one of the data points I had seen was that the census tract with the lowest penetration of people getting the vaccine is the census tract that is essentially kitty corner from the Washington Park Library. It's the census tract just east of Washington Park. And so we want to make sure that the people in that neighborhood where we are seeing far too few people being vaccinated know that they can go right over to the Washington Park Library. It's basically a 2-minute ride from where they live to the Washington Park Library to get a vaccine, again, Wednesdays and Fridays, noon to 4 p.m. In addition to that, we continue to offer pop-up vaccination clinics available across the city. And I just want to give you sort of a sampling of where they are. They're all over the place, and we're going to continue to try to get in the community as many different places as we can. And I want to again thank our health department for being so proactive and aggressive and creative. But today, Boys and Girls Clubs of Greater Milwaukee, which is located at 1975 South 24th Street, will be offering vaccinations to the public from noon to 6:30 p.m. Tomorrow, Friday, June 4th, Employ Milwaukee, which is located at the corner of North Avenue and 27th Street, will be offering vaccinations from 9:30 a.m. to noon. Independence First, just south of downtown on 540 South 1st Street, will be offering vaccinations from 10 a.m. to 2 p.m. And this weekend, the Wisconsin Black Historical Society, which is located basically at the corner of 27th and Center, will continue its monthly vaccination clinic from noon to 4 p.m. Again, that's this Saturday. Mexican Fiesta continues to step up. It's also hosting Viva MKE Marketplace on Saturday from 11 a.m. to 4 p.m. at Flores Hall, which is located at 2997 South 20th Street. The health department will be on site with vaccinations, and anyone who gets their vaccine or who brings their vaccination card to the marketplace will receive a free Mexican Fiesta ticket. Saturday and Sunday, 10 a.m. to 4 p.m., Summerfest will be hosting its drive-through clinic at 200 North Harbor Drive. Again, a freebie here. Anyone who gets their vaccine will get a free ticket to Summerfest 2021. And participants there should head toward the south gate of the Summerfest grounds. There will be signage and personnel to help direct traffic. But there's more. Black Husky Brewing, which has been a real great partner in River West, will be holding a vaccination clinic on Saturday and Sunday from noon to 6 p.m. So not only will everyone who gets the vaccine get a free beer, but you will, if you bring an unvaccinated person, you both get a free beer. So there you go. This is a cheap date. Bring someone and get a shot. In addition, they'll have live music and food trucks throughout the weekend. On Saturday, brats, hot dogs, and hamburgers will be available, and at 4 p.m., music will be performed by the Millbillies. On Sunday, Pedro's South American food will be available for the first half of the clinic. Then Tots on the Street will take over the second half. And DJ Micah will be playing live music at 1 p.m. So a lot going on, a lot of opportunities in the city this weekend to get the shot. But speaking about getting out and doing what we love, I want to share that downtown dining begins today, actually, June 3rd, and runs until June 13th. So please take part in this annual tradition to support local businesses and enjoy delicious food options in the heart of our city. Over 20 restaurants will be offering curbside, carryout, indoor, or outdoor dining options. To view the full list of menus, go to downtowndiningmke.com. I'm also pleased to report, as we get life back to normal, Milwaukee Public Library has announced the return of many services beginning Monday, June 7th. Patrons will be allowed to resume browsing. This is something they haven't been able to do since March of last year, but you'll be able to go back to the stacks, resume browsing materials in the stacks for both children's and adult materials at all branch locations. However, browsing will remain restricted at Central Library while staff prepare the space for a safe and healthy return by August. But again, you can see we're starting to open up. Staff and visitors of City of Milwaukee buildings will continue to be required to wear a mask, and that includes the libraries. Curbside service remains an amenity for patrons by request, but community service spaces and other meeting rooms continue to be closed for the time being. Lastly, I want to share even more positive news, and this is one where I'm very, very thankful to the county executive and the incredible county team and city team, because the Milwaukee Continuum of Care, if you're not familiar with this, it's a partnership between the city and the county, and it's really the lead agency responsible for coordinating resources for individuals experiencing homelessness in Milwaukee. And I'm very proud of the Milwaukee Continuum of Care. And again, County Executive Crowley will rightfully take a lot of credit for this, but this has been a partnership between the county and the city. But what we do each year is we actually take a snapshot. We take a snapshot as to who is homeless in Milwaukee. And so it's an annual census of all those experiencing homelessness. And we have teams that go out and look under bridges, look at places where people are generally when they're homeless, and we get that count. And we do that so we have a handle as to how serious the homelessness problem is here in Milwaukee and Milwaukee County. What was amazing was that during this year's point in time count, which is again that census, that snapshot, only 17 individuals experiencing unsheltered homelessness were out on that night in January. This is the lowest count recorded to date by the Milwaukee Continuum of Care. The fact that our community is reporting a dramatic decrease in homelessness during the pandemic is a success and is really worth noting. And there's, again, so many people that we have to give credit to. But at the onset of COVID-19, we knew people with unstable housing would be particularly vulnerable in the pandemic. And so as part of the Continuum of Care partnership, the city's Department of Administration and Health Department worked to establish housing, including, as you may recall, several local hotels. And it turns out this was a rousing success. We also worked with Milwaukee County and the Archdiocese of Milwaukee to create space at Clare Hall, which sort of straddles the Milwaukee-St. Francis border. So again, Milwaukee County, fabulous partner, Archdiocese of Milwaukee, fabulous partner, because at our greatest time of need, we got together and created the amenities that we have at Clare Hall. All these results could not have been possible without the swift action and collaborative relationship between the city, the county, and our private and philanthropic partners. In the wake of the COVID-19 pandemic, as shelters were forced to limit their capacity to reduce the spread of the virus, so you would think the numbers would go up, our community actually came together and pivoted very quickly to address the real-time needs of our residents. This list could go on forever, but I do want to name several key people within city government who have stepped up. Steve Mahan and Rafael Acevedo in our Department of Administration, Dr. Nick Tamaro in the Milwaukee Health Department, Joshua Parrish in the Milwaukee Fire Department, along with all their team members and all the great partners at Milwaukee County, which has a very, very strong team, as well as our partners in the private and philanthropic sectors. So with that, I'm going to turn it over to David Crowley, who rightfully should take a lot of credit for this as well. So Mr. County Executive.
Well, thank you so much, Mayor Barrett, and good afternoon to everybody who's joining us. And I first want to say thank you to the city as well as Mayor Barrett for its strong partnership. Because when COVID hit, most cities experienced increased numbers of individuals experiencing homelessness. And as shelters were forced to limit their capacity to reduce the spread of the virus. Yet during the same time, Milwaukee County ranked among the lowest nationwide for individuals experiencing unsheltered housing due to our expanded street outreach, the CARES Act funding, the eviction prevention outreach, as well as the emergency housing placement. So this is a remarkable point worth noting. Protecting our most vulnerable populations from a COVID outbreak was imperative, and our community worked together to find innovative housing solutions and very quickly. And so when the Housing First program began in 2015, about 1,521 individuals were experiencing sheltered and unsheltered homelessness. And by 2017, that number dropped to 900. So we know this is working because today we have just about 17 individuals experiencing sheltered or unsheltered homelessness, 817 individuals experiencing sheltered and unsheltered homelessness. And that's a 46% reduction. In Milwaukee County, we've allocated over $20 million, which includes eviction prevention, mortgage assistance, and support at Clare Hall. And through Milwaukee County Supportive Housing Services, we helped individuals with mental illness in obtaining safe and affordable housing. Because we know that housing is a social determinant of health, and these promising numbers show that we can be what can be possible when all of our members of everyone in this community work together on a particular issue. And so with this new funding available, the funding availability of the Continuum of Care of the Milwaukee County DHHS and its local partners will continue to hope it will get closer to achieving its mission to end homelessness right here in Milwaukee County. So again, I want to say thank you to the city for its partnership as we work together to serve our residents. Next, I want to share updates about amendments to Milwaukee County's Universal Face Mask Administrative Order. So today we announced that we are loosening up some of the restrictions based on the consistent positive trends in vaccination rates and low infection rates. So the following revisions are now in effect, which are all capacity limits are lifted in outdoor settings. So restaurants and other venues can operate at full capacity outdoors. Capacity limits decreased in indoor settings to the lesser of, so 75% of pre-COVID capacity, one person per 30 square feet of usable space, or 750 people. So departments longer need to submit reopening plans for services or events that are entirely outdoors. So we don't need that anymore. So some indoor safety requirements are being loosened, particularly for indoor events. So for example, less rigid seating arrangements and the use of buffets. And so as we move forward with our stepwise approach, and if positive trends continue, we expect to lift all indoor capacity requirements by July 4th. And so we cannot provide a timeline for changes to the face mask policy at this time, but we will continue to seek advice of public health experts, watch the data, and monitor guidance changes from the CDC to inform any future changes. And honestly, we're encouraged by these positive trends that we're seeing, but we will continue to take careful and measured approaches to reopening. And lastly, as the mayor mentioned, it's downtown dining week. Our food and beverage industry was among some of the hardest hit by this pandemic, and they need our support and a boost as everyone tries to recover from these difficult times. So downtown dining week, it runs through June 13th. So please check out the list of participating restaurants. You can support your local business, all of our local businesses, by ordering out or dining in while practicing safety measures while you do so. So let's go out there and enjoy the positive trends in vaccination rates. And with that, I want to say thank you for joining us, and I will hand it off to Dr. West.
All right, thank you, Mr. County Executive. Good afternoon. First, to our numbers, we are currently seeing in Milwaukee County an average of about 30 new cases a day and about 1 death every 2 days. And we're seeing about 1,600 people being vaccinated each day. So that is down about 25% from the increase that we saw just a week ago. And we did add a new page to the Municipal Trends tab on our public Milwaukee County dashboard to view vaccine doses in the county by race and ethnicity. But overall, trends across the board in disease burden continue to improve as more and more people get vaccinated. And on a very positive note, we're at 2.2% positivity. 2.2% of tests are resulting positive. That's the lowest we've seen since we started tracking the data back in March of 2020. And this is quite an accomplishment, and it's a testament to the increased vaccination rates in our community. Today, the Milwaukee County Office of Emergency Management core team, in partnership with the Milwaukee Health Department, had a pop-up vaccination site at the zoo, getting more vaccines into arms in our community. And as we work on at-home vaccinations through our Healthy Homes program, we'll also continue to trial these sort of pop-up sites where crowds already exist in the county to help break down as many barriers as possible to vaccination. Now, as I've done on occasion, I wanted to talk through a few questions that I've received from community members. First, a woman from Shorewood asked about masking. She said that while she understands the change in CDC guidelines and she is fully vaccinated, she's not quite sure where and when she should continue to mask to stay safe. Now, a lot of this comes down to your own personal risk tolerance. If you're fully vaccinated, you can feel confident that the vaccine gives you a high level of protection from illness, and in particular, excellent protection from severe illness and hospitalization from COVID-19. However, the vaccines are not perfect, and though rare, breakthrough infections can occur. So with that in mind, when you enter high-risk situations indoors, where you'll be for longer periods of time and you may have many people around you, you may still want to consider wearing a mask. Now, this may be the case in particular when you have others at home who may be unvaccinated, such as young children or people at home who may be immunocompromised. Now, aside from unusual circumstances of crowding, when fully vaccinated, you can feel comfortable not wearing a mask when outdoors. And of course, anyone who's not vaccinated should wear a mask when indoors and in public places. To the next question, a woman in Milwaukee asked whether she should consider mixing vaccine doses. For example, getting Pfizer for her first dose and Moderna for her second dose. The short answer is no. The vaccines were studied and tested with the same vaccine for both doses. Now, particularly in the United States, where we have ample supply of all 3 authorized vaccines, sticking with the same manufacturer for dose 1 and dose 2 is currently recommended. Now, the longer answer is that we continue to study and learn more about mixing vaccines, mixing the first dose from one brand, the second dose from a different brand. And it may in fact be that getting 2 doses from 2 different vaccines may give you stronger or broader or more durable immunity than the same vaccine type. Now, that said, these studies are ongoing, and we just don't know enough about mixing vaccines at this point to suggest this practice at all. And also, on a side note, regarding second doses, if you are someone who missed your second dose, you should still get it, even if it's delayed. The second dose is key to give your immune system an extra boost and solidify your immunity. So even if that second dose was due a few weeks ago or even a few months ago, talk to your healthcare provider, talk to your health department to get your second dose. And last, I received a question from a man in Wauwatosa about boosters. So now that some of us are nearing 6 months out from vaccination, are we still protected? And will we need a booster shot? Now, the tens of thousands of individuals who were involved in the vaccine studies last fall continue to be followed, both for any side effects as well as to determine their continued level of immunity. And the good news is that the immunity from the vaccines remains strong. The data was previously released for those individuals 6 months out from the vaccine, and protection remains strong. And we'll continue to follow as we get to 9 months and then a year's worth of data from the initial vaccinations. Now, as with many vaccines, it's likely that at some point that immunity may wane and a booster may be required. And it's also likely that this booster may not only give that boost to immunity, but it may also give added protection against new strains of the virus developing around the world. We're lucky to not yet have seen a strain that truly evades the immune response built by the vaccines. But that's of course a concern and something to keep a close eye on in the future. So thank you for the questions. I certainly appreciate the engagement from our citizens. We're all trying to do what's best for ourselves, for our families, and for our communities. The progress over 6 months of vaccination has been really remarkable. We live in a very different county than we did at the beginning of the year. And with continued engagement, caution, and vaccination, we can continue to make more and more progress. Thank you and stay safe, and I'll hand it to Health Officer Rush.
Thank you very much, Dr. Weston. It's my pleasure to join today and give you a little update from the data side, and which really correlates quite nicely with what you've heard from the other 3 speakers today. We have a lot to be happy about when we look at the data. We're seeing decreasing case trends, both within the city of Milwaukee and in the suburban communities. And we're also seeing these decreases amongst kids who are under the age of 18. And another positive is the vaccination efforts. Vaccination efforts continue, and I'm happy to report that the 12 to 15-year-olds who just became eligible to get vaccine within the last 3 to 4 weeks are now up to almost 20% vaccination in that very short time. And next week's data report should show many of those 12 to 14-year-olds who started to complete their series, because that's a 2-dose series. But in Milwaukee County, we continue to see slight increases in both the percent of population that has started their series, that has 1 dose at 46%, and 39% that have completed the series. And again, the increases from week to week might only be 1% in each of those data points, but that's certainly important, and it's certainly trending in the right direction. We're still a little bit lower in Milwaukee County than our statewide numbers at 48% started their series and 42% completed, but we certainly are closing the gap. And most importantly, those numbers increasing is the most important thing at this point. So with that, let me go and show you the data on cases and vaccination right now. So what you see on your screen here is what we've been trending since last March. Numbers of new cases with the 7-day averages for the city of Milwaukee and the suburban communities. And again, you can see that we have had very, very few cases, a couple dozen cases countywide over the last several days. And we see very positive and decreasing trends. We have not seen cases this low as far as 7-day averages since very, very early in the outbreak. And that's very important to notice. When we look at our kids' data, as is on the screen right now, we see very similar trends, and we do see some decreasing, but it's not quite as low as we've seen it, especially back early September or back in June in the suburban communities, which was very, very low. But we're certainly trending in the right direction, and that's good to note. As we jump back to the whole county report, we have reflected previously that deaths are a lagging indicator, and for a couple weeks here, we hadn't reported a death. Sad to report that there have been a couple deaths reported within the last couple weeks, which is again, not too surprising, and certainly we've seen those numbers be very, very low. But just to continue to point out that for a certain subset of our population, especially those more vulnerable medically or older, they are having severe consequences and even death and hospitalizations as a result. Our demographic trends look very good. I'll show you the reproductive number. This has been something we've been tracking for transmission rate, and I'm proud to say that our numbers are less than 0.8 for transmission rate for the county, for the city of Milwaukee, and for the suburban communities. So while we've had a little bit of a fluctuation here over the last couple of weeks, we've largely stayed below 1, meaning that we're suppressing the pandemic in the community. And lastly, I'll leave you with just that spatial map of where cases have been occurring over the last 2 weeks. Again, the areas that are red are the areas that have had higher case burdens than others in Milwaukee County. And we see a lot of case activity throughout the north side of Milwaukee, and even a couple areas in both the northern suburbs and out here in Greenfield and West Allis. So again, we want to continue to point out that there is disease occurring in the community, and it's something that we're watching very carefully. Now, switching gears, I want to show you the vaccination report. And again, very positively, last week, I pointed out that we were on an increase for vaccination. The data this week reflects a decrease, but I would attribute a lot of this to the longer holiday weekend for Memorial Day, which likely closed some vaccination sites, or people were busy doing holiday things and didn't get their vaccine. But it was nice to see this increase here, probably largely precipitated by 12 to 15-year-olds seeking the vaccine, but certainly there are others in our community seeking vaccine. At our peak, we had almost 14,000 a day. Right now, we're in that about 3,000 a day range for vaccines, but certainly we know that there's a lot more people in our community who need to get vaccine, and I'll touch upon that a little bit later as well. We've looked at the data looking at age groups and related to completion of the series and starting the series of vaccines. So this graph shows starting the series of vaccine. And we see that our older populations have largely been vaccinated at the highest levels so far, but we're seeing pretty marked increases amongst our 12 to 15-year-olds, as well as our younger populations, even the 16 and 17-year-olds. And we'll continue to see that. When we look at vaccination completion, the same disparity exists, but we'll certainly start to see the completion of the vaccination series for 12 to 15-year-olds coming up next week, including my younger son. So very happy to see more of our young people getting vaccinated. Similarly, we've tracked vaccination by race and ethnicity. White, Asian, Hispanic, Latinx, and Black or African American in that order on this graph for at least one dose. As far as completion, we see the same sort of disparities, but we're seeing some pretty strong increases in all of those population groups, especially the minority groups, and continuing to see that vaccination rate increase, which is very, very positive. The other thing, I like this graph a lot because it shows you which proportion of people is starting to get vaccinated. So this is color coded, so you can see early on a lot of the 80-year-olds and the 60 and 70-year-olds were getting vaccinated. And now you've seen a real big surge in the 12 to 15. So this particular schematic here, this graphic here, gives us an opportunity to see which percentage by age group is getting vaccinated more recently. So we're seeing some growth not only in that younger population over the last few weeks, but we're also seeing some growth in 40 to 59, as well as 25 to 39-year-olds. And again, we do the same sort of graphic here by race and ethnicity, and we see some increasing amongst the Hispanic Latinx population, as well as the Black and African American population over the last few weeks. So again, very positive news on the vaccination front, and certainly indicative that we're moving in the right direction. So with the data complete for today, I just kind of wanted to wrap up my comments just to talk about some overarching issues related to the state of the COVID pandemic. And very similarly to Dr. Weston, these are questions that we continue to hear either from the public, from our citizens, from others that come into our health department. And number one, I just want to start with, there's still a risk for disease. And while I've stated and others have stated we're at some of the lowest rates, disease is still occurring in our community, but it's been very, very low compared to where we were at the worst case scenario. We continue to see cases throughout our community, at workplaces, at schools, others. We know of school children who've been quarantined because of positive cases. We've seen sports teams quarantined because of positive cases. And certainly where we're seeing the most risk is for those individuals who have not been vaccinated. In fact, more recent data suggests that the large majority of new cases are occurring in those persons who are not vaccinated or who are under vaccinated, meaning that their vaccine is in progress. They might have completed the first dose, but haven't completed the second dose yet. And that continues just to underscore the importance of completing the 2-dose vaccination series, as vaccination is one of the most important things you can do to keep yourself safe. Now, in addition to vaccination, you've heard us for many, many months talk about other safety and mitigation measures that continue to be important. And we know the mask guidance, and Dr. Weston touched upon this a few minutes ago, can be confusing. But let's just recap again. 3 weeks ago, federal health officials from the CDC changed the masking guidance. Basically, they said at that point, if you're vaccinated, you can forego your mask in most locations, both indoors and outdoors, because the vaccine will protect you. In the same guidance, they said if you're not vaccinated, masking remains a great way to lessen both your risk of transmitting the disease, as well as getting the disease from somebody else who might be shedding the virus. So in that case, unvaccinated individuals should continue to wear masks in all settings as much as possible. We also know that with the changes in federal masking guidance and even local changes in masking guidance, businesses and other establishments throughout the community may still have different rules. We know, for example, the CDC masking recommendations didn't change anything for healthcare settings. K-12 schools, masking is still strongly recommended, and in certain summer camp settings. And while we don't know what will be foretold for masking and some of these other measures in school in the fall, that's something that local health officials and our state health department and CDC are looking at very carefully as we plan for fall. But most importantly, I want to say today that when you're wearing a mask, we need to be cognizant of the situation you're in. We're having a warm weather boon this weekend that we don't typically see in early June. And so with warmer weather this weekend, I want to encourage all of those that are wearing masks, whether indoors or outdoors, to make sure to give themselves extra mask breaks. You might find yourself short of breath with the heat and the humidity. And in workplace settings, this is especially important, especially in workplace settings like factories and other manufacturing facilities that might not be air conditioned. I would want to encourage workers who are working in those settings to continue to be cognizant of the heat and the humidity and take frequent mask breaks as needed. And also, I'd like to encourage management in those facilities, those manufacturing facilities and factories, to be aware of that as well from a safety and health perspective. We want to prevent transmission of COVID, but we also want to keep people safe as well. And lastly, today, I want to continue to reach out to all of you to be a champion for others to get their vaccine. Last week, I told you the story about my 14-year-old son who wasn't listening to his father, the public health figure and the public health official, but he was listening to his 14-year-old friend on his baseball team about getting vaccinated. So similar to my son's situation, your personal vaccine story may be the positive motivator for others. So continue to tell your story, continue to talk to your friends and coworkers and loved ones. Encourage them to get vaccinated as well so that we can boost those vaccination rates and move towards a new normal. Thank you for your time and attention, and I'll now turn the briefing back to Catherine for the question and answer portion.
Thank you, Director Rausch. We have several questions coming in through the chat. Our first ones come from Sharon Bragenda with CBS 58. Dr. Weston, with today being the first day of Downtown Dining Week, what is the level of risk associated with dining out at this point in the pandemic?
I feel good about dining out. I've been dining out. I've brought my kids dining out. I missed and now very much enjoy dining out. I think it's like anything else. I think you take similar precautions that I talked about before. I very much prefer restaurants that have outdoor dining. I think it's a safer way to eat, especially if I'm bringing unvaccinated kids along. So I think considering the precautions that the restaurant is taking and the setup of where you're going, but certainly I have missed and now very much enjoy going back to outdoor dining and to dining in general.
And Mayor Barrett, restaurants and other hospitality businesses are experiencing a major worker shortage in the city. What is your message for them amid this busy and demanding time?
Well, you're absolutely correct. I would say that many restaurants are experiencing labor shortages. And I think it's a reflection of several things. I think it's certainly a reflection of the fact that this is still difficult work for a lot of people. The hours can be long. It can be work that's not as financially rewarding. But I think it's going to take aggressiveness to try to get people back there. And what it might end up doing is raising their pay. And that's not the worst thing in the world. Because I think people will respond to that. But I certainly acknowledge that this is a difficult time for a lot of restaurants to find workers, and that's a challenge.
Our next question is from Joyce Garbasiak with Channel 12, and it's for Dr. Weston. She's wondering, is the county tracking COVID infections among the unvaccinated? And for those who are currently hospitalized for COVID, are they primarily unvaccinated? And what percentage of COVID patients in the county are unvaccinated?
So it's a great question. We are looking into ways to connect those two data sets together. So, and they are two data sets. The vaccination status is the Wisconsin Immune Registry, and then the COVID positivity status is a different state database. And so pulling those two together is challenging. It certainly is something we're looking into. Now, that said, there have been plenty of studies and other communities that have linked that together and shown that the vast majority of people who are getting infected are unvaccinated. The vast majority, we talked a couple weeks ago in Ohio, the entire state of Ohio, it was 99.7, almost 100% of people who've been hospitalized with COVID in that state since January are unvaccinated. And so these links are very strongly established. Vaccination is the best way to prevent infection and also an outstanding way to prevent severe disease and hospitalization.
Joyce's second question, perhaps Director Rausch or our health officials could jump in here. To what do you attribute the lower case counts? Is it the vaccine, or is it part of the reason fewer people are being tested?
I can start here. So I think that the lower case counts, I think the lower disease burden overall is absolutely because of vaccination status. I think we're seeing a direct result of increased vaccination in our community and decreased disease burden. Now, the case counts in particular, the number of new cases per day, are tied to the number of people getting tested. So that is a fair point. Now, what's not as tied to the number of people getting tested is our percent positivity, now lower than it's been since the beginning of the pandemic. What's also not tied to the percentage or the number of people getting tested is our hospitalization count, which is also at a low. And so these are a variety of the indicators that we look at when we consider disease burden. And overall, we're seeing a very promising decline in our disease burden in the community as a result of people getting vaccinated. And I think as we see more and more people get vaccinated, we'll see that continued decline in disease burden.
Our next question comes from Aaron Mabin with Fox 6. He's wondering, how does the county lifting restrictions affect county parks and pools this summer?
A good question. So if you are visiting our county parks, you no longer need to wear masks. But as it relates to our pools, if you are at an outdoor pool, they will be at 100% capacity. But if you are in an indoor pool, we're still asking that folks take safety precautions, and we'll be operating about 75% capacity there.
Thank you, County Executive. Chuck Kornbach with WUWM is wondering, for Dr. Weston, perhaps, how would you characterize the census tracts with the lowest vaccination rates? Where are they, social economic status, and any specific plans for reaching out to these tracts?
Sure. So we've seen since the beginning of the pandemic in disease burden, in death rates and in vaccine access lower levels among our vulnerable communities, in particular, our communities of color. We saw that with vaccination rates. It's illustrated in the EVE model on our public-facing dashboard that vulnerability ties very closely with lower vaccination rates. Now, we realized this early on, and we continue to work to address it. Those census tracts that have the lowest vaccination rates combined with highest level of vulnerability was what we as a county, partnering with health systems, partnering with health departments, partnering with community organizations, are trying to target, and we're seeing good results. We're seeing increases in the number of people going out to get vaccinated in our more vulnerable communities. But we know that barriers continue to exist in those communities. And that's part of the reason why we are trying to bring vaccination to people. The Milwaukee Health Department has a lot of examples of how they've brought vaccinations to where people already are. You break down every barrier you can and bring vaccinations to workplaces, to libraries, to schools, places like that.
And that's exactly why, for example, I highlighted the Washington Park Library. The Washington Park Library is adjacent to several areas that have some of the lowest immunization rates. And so we want the people who live in these neighborhoods in the area just east of Washington Park to know just how incredibly accessible the vaccines are to them. And we want them to get that. I'd love to see us over this weekend turn that census tract around and have it go from being one of the most challenged census tracts to one of the most successful census tracts in the entire community. And what it's going to take is, I think, more outreach to say, hey, it's here right now. Please come and get the shot.
Thank you both. Joyce Garbasiak with WISN 12 is wondering, for the county executive, with the extreme heat expected for the weekend, will the county be making any accommodations in terms of keeping pools, splash pads, etc., open this coming week? And currently, they're set to only be open on the weekends until mid-June.
So good question. So Cool Waters did open up last weekend, and Cool Waters will continue to stay open only on the weekends until about June 14th. And then after the 14th, they will open up until the end of the season. But unfortunately, our splash pads and pools will be closed and will not be opening up until mid-June. We're just not ready for this at this time, but we know that we got a crucial weekend coming. So let's just make sure that everybody finds a way to cool off.
Thank you, County Executive. Allison Durr with the Milwaukee Journal Sentinel is wondering, in the days since the city's mask mandate lifted, have city officials been made aware of any issues between business owners that are still requiring masks and members of the public who object to wearing them, citing the lack of city requirement?
In my conversations with our health department officials, we have had widespread support for our decision. In fact, we did sort of a roundtable in our internal meeting 2 days ago, and we hadn't gotten any complaints from anybody. So I think people were ready. I think people were ready to go back. And so whether it's from employers, whether it's from customers, I think everybody understands now, if you want to wear a mask, feel free to wear a mask. Don't shame anybody for wearing a mask. And if you're not vaccinated, wear the mask. But I think there's such a desire to return life to normalcy that people appreciate that. And I think they appreciate those business operators who, for whatever reason, decide they still want to have people wear masks.
The last question I'm seeing is from Sari Lesk with the Milwaukee Business Journal. Were the people who recently died of COVID-19 in the community vaccinated?
So we don't have that specific information for deaths in our community. What I can say is when we look at broader data sets around the country, without a doubt, pretty much 100%, very close to 100% of people who are dying from COVID infection are unvaccinated or not fully vaccinated.
And Joyce Garbasiak with WISN 12 is wondering, are there any plans to offer the vaccine at the city's Juneteenth celebration?
That would be an absolute yes. Dr. Tito Izzard, who runs the MLK Heritage Health Center, that location is going to be offering vaccinations. Walgreens across the street is going to be offering vaccinations. We believe that will be adequate, but if there's an overwhelming surge, we have the ability to come in to help. But working with Dr. Izzard and his team, working with Walgreens, we think it's going to be very well served. And it's our hope that a lot of people on Juneteenth Day will take advantage of this opportunity to get the shot.
few more questions coming in here. Will the health department, from Allison Jerwitz, Milwaukee Journal Sentinel, will the health department still be doing vaccinations with backpacks at Juneteenth?
It's my understanding right now, and we can correct this if I'm wrong, that we're going to be, at his request, Dr. Izzard and his team in Walgreens are going to be providing the vaccination. So let me double check on that, but I think that was what the final arrangement was.
And Chuck Kornbach with WUWM is wondering, has there been any word on more Biden administration officials coming to Milwaukee to promote the vaccine? What do you think about the free beer idea? Will Miller compete with Bud?
I think that's a great idea. I think it's a wonderful idea. So I thought it was a pretty clever idea. Maybe they stole it from what's going on here in Milwaukee, where you've got several establishments offering free beer now, but we can give away bratwurst, we can give away all sorts of good stuff. So whatever it takes is my view.
Well, I think that's a good note to end on. Those are all the questions I am seeing in the chat. Thank you, media, for all of the great questions. Take care, and that will conclude our briefing for today.
Thanks, everybody.
Thanks, everybody.
Thank you.